Can a deviated septum cause congestion and mouth breathing? Have you ever wondered how a simple structural issue in your nose can affect your breathing at night? Let's take a closer look at the connection between a deviated septum, congestion, and mouth breathing, especially in the context of sleep apnea. A deviated septum happens when the bone and cartilage that separate your nasal passages are misaligned. This misalignment can make one side of your nose smaller than the other, leading to nasal obstruction. When airflow is restricted, it can cause congestion because mucus has a harder time clearing out. When your nose is blocked, you may find yourself breathing through your mouth, especially while you sleep. Mouth breathing is a common response when nasal breathing is difficult. However, this can create more problems for people with sleep apnea. While a deviated septum does not directly cause sleep apnea, it can make the condition worse. The obstruction in your nasal passages increases resistance to airflow. This can lead to more severe breathing difficulties during sleep. For those already experiencing sleep apnea, this means more frequent or severe apnea episodes. Mouth breathing, which often occurs due to nasal congestion from a deviated septum, can increase the risk of airway collapse. This complicates the management of sleep apnea, making it harder to breathe effectively during the night. If you are using continuous positive airway pressure therapy for sleep apnea, a deviated septum can affect how well the treatment works. Nasal congestion and mouth breathing can reduce your comfort and the effectiveness of the therapy, especially if you are using a nasal mask. For individuals with a deviated septum, using a full-face mask for continuous positive airway pressure therapy may be more beneficial. Additionally, addressing the nasal obstruction through treatments like surgery or managing allergies can help improve your situation. In summary, a deviated septum can indeed cause nasal congestion and lead to mouth breathing. This can worsen sleep apnea symptoms by increasing the likelihood of airway collapse. If you are using continuous positive airway pressure therapy, consider discussing your options with your healthcare provider to optimize your treatment.